Health leaders in the United States are now warning there could be deaths from the fast-moving swine flu. Here are the latest developments. The number of confirmed cases in the United States rose to 64 today, with the largest concentration here in New York City. 152 deaths in Mexico are now linked to the virus. Cuba became the first country to impose a travel ban, suspending flights to and from Mexico for 48 hours. And Carnival Cruise Lines canceled today's scheduled stops in Mexican ports. People in Mexico are saying don't blame them for the swine flu. Even with the number of dead and sick in that country, many there claim the killer virus didn't originate in Mexico. CNN's Ted Rollins picks up the story.
This is the Polanco district of Mexico City. Basically, it's a working class area, and a lot of businesses are here. People come to work, and they use the subway system coming and going. We asked them what they think about where the virus came, and we got a lot of the same opinions. Not one person here believes that the virus originated in Mexico.
Somebody got it in Canada and then gave it to somebody in the United States who brought it here. A Canadian was here visiting and got sick and sent to the hospital, and that's how it started to spread. It's a fever from Asia that came here to this country.
Where do you believe the virus started?
Okay, I believe it started in Oaxaca with a tourist.
From the United States?
Yes, maybe.
We've talked to people on the street here for the last few days. Nobody has told us that they think it has originated here in Mexico.
It's not something you create, it's something that mutates and happens, but no one wants to claim responsibility for something so bad as this.
Whenever anything bad happens, the U.S. always blames it on Mexico. So, you know, all the drug problem is Mexico's fault. Everything is always Mexico. There's one jalapeno which gets some old lady sick in Indiana. It's definitely Mexican. So, I mean, Mexico is the thing the U.S. always kicks around. When we want to kick someone around, we kick Mexico. So, naturally, people here are very sensitive about it.
Rollins is on the scene for us in Mexico City. Thank you, Ted, very much. Let's go to the Mexican ambassador to the United States. He's joining us now live, Arturo Sarukhan. Mr. Ambassador, thanks very much for coming in.
It's a pleasure, Wolf.
How convinced are you that this swine flu outbreak originated in Mexico?
We still don't know. This is something that authorities in Mexico and authorities in the United States, CDC, are trying to figure out. We can't pinpoint the origin of the outbreak, and we certainly don't know where it started and how it propagated. This is one of the issues that we're very quickly trying to work with our Canadian and American partners to find out.
The assumption is it started in Mexico because most of the cases, and certainly almost all of the fatalities, have been in Mexico, and there's an area not far from Mexico City that has a large pig population.
Well, that's one of the speculations that's out there, but it still is not clear whether that was the origin. It is true that we have a very high concentration of cases in Mexico, and in particular in Mexico City, but we're working very hard to determine where this started and, more importantly, how it is being passed on.
Do you know why so far people are dying in Mexico from swine flu, but they're not dying elsewhere?
No, I would certainly not know, Wolf. We're trying to find out what it is, whether it has to do with when people go to the hospital, at what stage of the disease they go to the hospital. But no, this is something that I still don't know.
Because I assume there are a lot of cases that are simply unreported in Mexico. For all the cases that are officially documented, there are probably a lot of others that people just get sick and they hope they're going to get better. Is that right?
Well, that may be the case. Remember that we first started detecting this and were able to pinpoint that this was a new strain of influenza, more or less at the same time that the flu season was winding out in Mexico. So there may have been other cases. But certainly we're trying to very aggressively, quickly, and transparently figure this one out, ensure that our communication with the United States, Canada, other countries, and the World Health Organization is allowing us to very quickly pinpoint the origin, pinpoint the contagion rates, and to be able to shut it down.
Was the State Department right yesterday in calling for a travel advisory against any non-essential travel to Mexico?
Well, the World Health Organization has not called for a travel ban or a quarantine or the shutting down of borders. I think that when you have a disease like this, common sense should be the keystone, and I think the people who are traveling should use common sense to determine whether they need to travel or they can hold back a few days or a few weeks until we can all figure out what's going on.
There's no doubt that Mexico, like so many other countries around the world, was suffering from an economic recession, major economic distress. Tourism already going down because of the drug issue. But now because of this, your country is in deep financial trouble as a result of this economic strain, the result of swine flu. Is that right?
Well, I think all the world is facing a profound global recession. I think Mexico is not the exception. I must say that figures for tourist revenues in the first part of the year are more or less on par to what they were last year. And more importantly, we have not seen any significant reports of influenza along the coastal regions of Mexico. So we're waiting to see what the impact of this is.
There's one report that you're losing $57 million a day in tourism revenue right now. Have you heard about that?
I have not seen those figures, Wolf.
But as you say, if people are nervous, they're not going to go to Cancun or Acapulco. They're not going to go on vacation to Mexico right now, at least until this swine flu crisis eases.
Well, I think that what is important right now for the Mexican government is to ensure that the health of our citizens and of other citizens traveling to Mexico from other countries is taken care of, that we ensure that by working with the United States and other nations that we can shut this down. This has to be our priority, and this is what we will focus on in the next days.
How's your supply of the masks, the antiviral medications? Are the stockpiles there, or are they dwindling?
The stockpiles of the medicine are there. They're strong. Face masks, at the rate that they're being used, are starting to dwindle, but we're already reaching out to certain countries in the world to ensure that our stockpiles can be maintained.
What do you say to those Americans who want to really tighten up, close up the border between the U.S. and Mexico and make it so much more difficult for Mexicans to come into the United States, either by land, sea, or air?
Again, if you look at previous experiences, Wolf, where there have been previous outbreaks of other diseases, this type of decisions don't do the job. They don't do the trick. It won't change the fact that there are already cases of influenza in the United States, that there are cases of influenza in other countries, and I don't think that the shutting of the borders at this stage, at least, will do anything to change that.
How's the level of cooperation between your government, the Mexican government, and the Obama administration on this issue right now?
It is excellent. We're building upon what we started doing. Canada, Mexico, and the United States knew that at some point we could face this type of challenge. Since 2005, Wolf, Mexico, Canada, and the United States have been working to streamline protocols, to exchange information, to create the mechanisms where we can very quickly react. And I think that the support that we're getting from the Obama administration is top-notch. I have been on the phone several times with Secretary Napolitano and John Brennan at the White House, and I think that the cooperation and the exchange of information is where it needs to be.
What do your health experts in Mexico tell you we should expect in Mexico over the next, shall we say, 2 weeks?
I wish I was Sanjay Gupta to be able to answer that one, Wolf. Basically, I think the mode right now is wait and see. We're trying to ascertain whether there's a leveling off of contagion and of deaths related to the virus over the next 24, 36 hours. And based on that, I think we will be able to start seeing some projections of how the virus either mutates or reacts in the coming days.
We're going to be speaking shortly with Dr. Sanjay Gupta. Mr. Ambassador, I'm sure you'll be interested in his report as well. Arturo Sarukhan is the Mexican ambassador to the United States. Mr. Ambassador, I hope you'll come back.
I will, Wolf. Thank you.
Thank you very much. And good luck to everyone in Mexico. A Republican defection, Senator Arlen